Hello everyone, thanks for attending my presentation. My name is Chen. I'm a PhD student from University of Virginia. The title of the abstract is Simultaneous Monitoring of Bone and Soft Tissue with a Rapid MRI Method for Focused Ultrasound Surgery. Parkinson's disease and essential tremor are neurological disorders that cause uncontrollable movement among millions of people. Medical therapies to reduce the symptoms of these disorders are effective in only a portion of patients. For example, deep brain stimulation can work well, but many patients are not candidates for surgery or would prefer a non-surgical option. MRI-guided focused ultrasound, or MRG-FUS, is a minimally invasive method of treating medically refractory essential tremor and tremor-dominant Parkinson's disease. During the treatment, ultrasound goes through the skull and the brain and focuses on the target tissue, leading to ablative temperature over 60 degrees Celsius. The skull also absorbs acoustic energy, which results in unintended heating of the skull and the nearby soft tissue, including the brain. However, no direct monitoring of this heating exists. An estimation of minimum waiting time between sonications can only be made using simple models. To address these issues, a rapid MRI method for simultaneously monitoring the temperature of bone and soft tissue during FUS surgery is necessary. The prevailing method for MR thermometry in aqueous tissue proton resonant frequency shift, or PRF, is based on a temperature-dependent phase shift with the same sensitivity coefficient for various tissues such as brain and muscle. However, PRF is not practical in short T2 tissue, such as bone, because it requires time for accumulating phase, but the signal of such tissue decays in extremely short period, much shorter than the normal echo time. Variable flip angle T1 mapping, or VFA T1 mapping, with the ultra-short echo time MR sequence is an alternative. As indicated by the equation, it uses the linear regression model to measure T1. Researchers have shown the linearity between the temperature and the T1 value of various tissues, including cortical bone. Therefore, combining these two thermometry methods using a dual echo UTE sequence has the potential to simultaneously monitor unintended skull and brain heating in MRG-FUS. In this work, we use the dual echo 3D spiral UTE sequence, which has a short rectangular f-pulse, variable slice encoding, and spiral trajectories, such that a rapid scan over a large volume is possible. The VFA and PRF methods were applied to the data from the short and long echoes respectively. The variable flip angles were 15 and 30 degrees. The first echo with a very short echo time is designed for capturing the quickly decaying signal of cortical bone. The data from this echo is processed for VFA T1 mapping. Second echo with a normal echo time, short enough for rapid scan and long enough for signal phase accumulation, used for applying PRF in soft tissue. The spatial resolution is 1.35 by 1.35 by 8 cubic millimeters. The scan volume is 130 by 130 by 80 cubic millimeters. The scan of each flip angle lasts 36 seconds. So the temporal resolution for PRF and VFA-T1 is 36 seconds and 72 seconds respectively. Homemade bone gel phantom was used for cooling and heating experiments with a 30 Siemens MR scanner and optical fiber thermometer. In the cooling experiment, a product hair coil was used. The phantom has a piece of cortical bone surrounded by agar gel both inside and outside. 3 optical fibers were fixed inside the bone, the inner gel, and the outer gel respectively. Near each fiber, a 4 by 4 pixel ROI was selected to shown on the left figure. The phantom was immersed in water bath before cooling. The scan was not started until thermal steady state was considered reached. 20-minute waiting time between temperature samples. The figure in the middle shows the changes of temperature and T1 along the cooling time. All data was smoothed over 4 scans and averaged across the corresponding ROIs. The PRF results from the inner and outer gel were within the 1.5 degrees Celsius deviation from the values by the optic fiber. The linear relationship between the temperatures and the T1 values of the bone could be clearly observed, and the sensitivity coefficient was calculated at 2.51 milliseconds per degree Celsius. The figure on the right displays the first-order polynomial fit over the temperature and the T1 values of the gel. The two slopes are very close to each other, which suggests the robustness of VFA T1 methods in gel. In a heating experiment, a product flexible surface coil was used to accommodate the FUS transducer. The phantom was similar to the one used in a cooling experiment. The bottom of the plastic cylinder that contained the phantom was removed so that the ultrasound could penetrate the gel and reach vertically the bone-gel boundary. An optical fiber was inserted in the gel with a 2 centimeter distance to the acoustic focus to sense the temperature rise remotely. 3 sonications, and each lasted 114 seconds. The scan is continuous throughout the experiment, covering both sonications and the cooling periods. Two 3 by 5 pixel LIs were selected near the boundary inside the cortical bone and the gel, such that we could assume that the temperature of these two LIs was approximately the same. No temporal averaging. The results are shown in the figures on the right. At the top is the PIF temperature of the gel versus the VFE-T1 of the bone. At the bottom is the fitting result between them. Linearity is clearly observed, with the sensitivity coefficient of 3.86 milliseconds per degree Celsius, comparable to the value in a cooling experiment. In conclusion, a method using a dual-echo 3D spiral T sequence was proposed for simultaneously monitoring off-target heating of skull and brain in transcranial MRI FUS. The method was validated in cooling and heating experiments using bone gel phantom. Future work includes calibration of the temperature T1 coefficient, accelerated imaging, improving SNR, and in-vivo testing. Thanks for your attention.